Good evening, and before we jump into the FDA's new update regarding the Johnson & Johnson vaccine, I wanted to quickly mention that earlier today, we published a phenomenal exclusive interview between myself and Dr. Robert Malone, the man who invented part of the mRNA platform that a lot of the vaccines are based on. And the discussion was enlightening to say the least, focusing on many topics, including the fertility issues that so many women around the world are currently suffering from, such as blood clots, cancer, spontaneous abortions, and delayed menstrual cycles, and whether these issues are possibly tied to the mRNA vaccines. If you'd like to check out that entire exclusive interview, you can do so over on Epic TV. The link will be right there at the very top of the description box. And now, let's jump into today's main topic of discussion, which has to do with this right here, which is the Johnson & Johnson vaccine. And over the past 2 years, people across the entire country, they were censored, they were suspended, and they were even banned from using social media for questioning this vaccine. Also, many people were fired from their workplace if they refused to take it. However, wouldn't you believe it? Just yesterday, the FDA released an official statement announcing that they will be severely restricting the use of the Johnson & Johnson vaccine due to serious concerns of a blood clotting disorder. Let me just repeat that. After 2 years of censorship and after 2 years of vaccine mandates, the FDA came out and they pulled back their recommendation of the Johnson & Johnson vaccine. Here is specifically what they said as a part of their newly released statement. Quote, after conducting an updated analysis, evaluation, and investigation of reported cases, the FDA has determined that the risk of thrombosis with thrombocytopenia syndrome, otherwise known as TTS, a syndrome of rare and potentially life-threatening blood clots in combination with low levels of blood platelets with onset of symptoms approximately 1 to 2 weeks following administration of the Janssen COVID-19 vaccine, warrants limiting the authorized use of the vaccine. Now, before we continue with our specific recommendations, let me give you a bit of background here. The severe condition in question here, the one that they mentioned in this particular statement, is known as TTS, otherwise known as thrombosis with thrombocytopenia syndrome, which is a very technical name, but in plain English, this syndrome presents itself as a combination of blood clots as well as a drop in platelet levels. And what's interesting to note is that it's actually a fairly new syndrome that was only identified recently after the rollout of the vaccines. In fact, it goes by 2 other names as well. It's also called vaccine-induced protothrombotic immune thrombocytopenia, or VIPIT for short, or you can also call it vaccine-induced immune thrombotic thrombocytopenia, or VITT for short. Whatever you actually call it, TTS is extremely serious, and typically individuals experience the symptoms of TTS sometime between 4 and 42 days after being vaccinated. And the symptoms can vary wildly depending on where the thrombosis actually occurs. So for instance, here are the potential symptoms that a person can experience. You have cerebral venous thrombosis, which manifests as a persistent headache, vision changes, seizures, confusion, or even potentially a coma. You have splanchnic vein thrombosis, which can manifest as abdominal pain. You have pulmonary embolus, which can manifest as chest pain as well as shortness of breath. You have deep vein thrombosis, which can result in leg pain, redness, and/or swelling. You have arterial ischemia, which can lead to symptoms similar to a heart attack, such as chest pain and shortness of breath. And then lastly, you have thrombocytopenia, which can lead to bruising, rashes, as well as general bleeding. And it's also worth mentioning that no matter how TTS manifests itself, well, it's very serious, and it can lead to both long-term disability or even death if it's not recognized and treated in a timely manner. Now, you might remember that back in the spring of 2021, meaning in the spring of last year, the concern around TTS was so heavy that there was an almost nationwide pause in the administration of the Johnson & Johnson vaccine. However, that pause was actually lifted because the FDA came in, at that time at least, and they made the official determination that the benefits of the Johnson & Johnson vaccine outweigh any potential risks. However, since then, more and more evidence has emerged linking TTS to the Johnson & Johnson shot. As just one example, according to this paper here, which was published in November of last year, researchers with the CDC found that people who got the Johnson shot were far more likely to experience TTS when compared to people who received either the Moderna or the Pfizer vaccine. In that particular paper, the researchers were looking at the number of adverse reactions which were reported through the VAERS system. And the VAERS system, in case you've never heard of it, stands for the Vaccine Adverse Event Reporting System. It's run jointly by the FDA and the CDC, and it's a place where people can go and report any adverse reactions that they experience from the vaccines. And so when those researchers looked at the data in the VAERS system in regards to TTS specifically, here are the numbers that they found. There were 3.55 cases of TTS reported for every 1,000,000 doses of the Johnson & Johnson vaccine which were administered, compared to only 0.0057 cases per million for the other vaccines. Meaning that although it's still technically rare no matter which shot a person takes, the incidence of it happening with the Johnson & Johnson vaccine is a whopping 621 times more than with the others. Furthermore, it was found that the rate was highest among women aged 30 to 39 years old. Now, by the end of last year, meaning that by the end of 2021, the VAERS database showed that there have been 1,700 cases of TTS following the administration of a Johnson & Johnson shot. There were also 1,429 separate reports of thrombosis, as well as 265 reports of thrombocytopenia. And altogether, these conditions have resulted in the deaths of 89 people. Although it is worth noting that the VAERS system is a passive reporting system that anyone can report to. However, according to previous studies, they've actually indicated that the number of reports which are submitted to the VAERS system is usually an undercount, meaning that since it's a passive system, there are likely more cases which just never go reported. Regardless, though, even with the data that has been submitted to the VAERS system, the FDA decided to take action. To start with, back in December, meaning back in December of 2021, so about 6 months ago, the FDA actually updated their fact sheet for the Johnson & Johnson vaccine, and they added a warning to people who have had a history of TTS following vaccination to not get the Johnson shot, meaning that since December, TTS has been listed as a contraindication to getting the Johnson shot. Furthermore, back in December, the CDC's panel on vaccines, they got together, they had a meeting, and they watched about 4 hours worth of presentations regarding adverse reactions from the Johnson & Johnson vaccine. Then they subsequently voted, and they unanimously agreed that the CDC should tell the general public that the Moderna and Pfizer vaccines are preferred over the Johnson & Johnson shot. Here was specifically what the recommendations stated, again, all the way back in December. Quote, mRNA COVID-19 vaccines are preferred over the Janssen COVID-19 vaccine for the prevention of COVID-19 for all above 18 years of age. However, even though the CDC panel was trying to sound the alarm, back in December, the FDA, well, they chose a different route. That's because despite adding the warning regarding TTS, here was the actual statement that the FDA released all the way back in December. Quote, the FDA continues to find that the known and potential benefits of the Janssen COVID-19 vaccine outweigh its known and potential risks in individuals 18 years of age and older. Individuals should speak to their healthcare provider to determine which COVID-19 vaccine is most appropriate for their own situation. Again, just to reiterate, that statement that we just read was all the way back from December, meaning that it was from over 5 months ago. However, just yesterday, the FDA decided to change course. That's because, as I mentioned earlier, they just put out this statement here, which officially limited the use of the Johnson vaccine to only certain individuals because of the risk of this potentially life-threatening side effect. Here's specifically what their new restrictions say. Quote, today, the U.S. Food and Drug Administration has limited the authorized use of the Janssen COVID-19 vaccine to individuals 18 years of age and older for whom other authorized or approved COVID-19 vaccines are not accessible or clinically appropriate, and to individuals 18 years of age and older who elect to receive the Janssen COVID-19 vaccine because they would otherwise now receive a COVID-19 vaccine. Meaning that they are restricting the Johnson shot only to adults 18 years or older who either can't receive the mRNA vaccine or who refuse to take the mRNA vaccine. In fact, the FDA provided some specific examples of people who still can receive the Johnson shot, and it includes, quote, people who suffered an anaphylactic reaction after receipt of an mRNA COVID-19 vaccine, people who have concerns about receiving mRNA vaccines and wouldn't otherwise get a COVID-19 vaccine, and people who would stay unvaccinated because of limited access to mRNA COVID-19 vaccines in their areas. Although frankly, at the moment, it's not exactly clear how the FDA will enforce this new guideline. Furthermore, in regards to their reasoning for this new direction, well, here's what the statement said, quote, in making the determination to limit the authorized use of the Janssen COVID-19 vaccine, the agency considered that reporting rates of TTS and TTS deaths following administration of the Janssen COVID-19 vaccine are not appreciably lower than previously reported. Furthermore, the factors that put an individual at risk for TTS following administration of Janssen COVID-19 vaccine remain unknown. The FDA also considered that individuals with TTS may rapidly deteriorate despite prompt diagnosis and treatment, that TTS can lead to long-term and debilitating health consequences, and that TTS has a high death rate. And the kicker to this story, at least in my opinion, the cherry on top, if you will, is that the censorship regime of big tech is so severe that when the FDA initially put out this advisory, well, Twitter added a warning saying that it was misleading. You can see the warning right there up on your screen, and it says, quote, misleading. Learn why health officials consider COVID-19 vaccines safe for most people. And the reason that I say that this Twitter warning is the cherry on top is because it perfectly captures, it completely elucidates, and it brings into focus the regime of censorship that we all are living under, where big tech algorithms just censor whatever they feel isn't true, even if it comes from the FDA itself. It also answers the question of why you might have never heard about TTS before. Regardless, if you'd like to read about this new decision from the FDA for yourself, as well as the studies regarding TTS, I'll throw all that into the description box below this video for you to check out. And all I ask in return is that you take a super quick moment to smash that like button for the YouTube algorithm. And now let me tell you, sorry, what's this?
It's me. Of course it's secure.
because we use the Sekur app, which is the sponsor of today's episode, as well as an awesome email and message service provider that actually cares about your privacy. Now listen, it's no big secret that our data is being mined and remined all the time. In fact, there was a recent study that was published in the year 2020, which found that 155 million Americans, likely including you and me, have suffered some form of data breach. And frankly, that's only what's publicly known. However, all those past problems with privacy issues and data mining, well, that can be an issue of the past, because moving forward, you can use the Sekur app, which both your messages, your emails, and your phone calls can remain private. That's because they have their servers and their data centers located in Switzerland instead of in the US or China or Russia. And why does that matter? Because Switzerland has the strictest data privacy laws in the entire world, and they are not subject to the intrusive Cloud Act. Now, what I love the most about the Sekur app is that they don't collect my data, they don't mine my data, they don't mine the data and phone numbers of my friends and family. Everything is private. And best of all, at least in my opinion, this does not work with your big tech email provider just because it is not secure. And so check it out. You can head on over to sekur.com, and if you use promo code Roman, you can get 25% off. And frankly, their rates are not even that expensive. It only starts with $5 for the messenger and $10 for the email and messenger combo. And best of all, they offer a 7-day free trial. Now, in closing, I'd like to mention that earlier today, we published a super spicy 45-minute long interview between myself and Dr. Robert Malone, who holds several of the patents to the mRNA technology platform. And the topics we covered in that interview were many and varied, including key questions such as why are so many women in this country and across the entire world experiencing delays in their menstrual cycles? And also, are there blood clots, cancers, spontaneous abortions, and many other fertility issues that women are now experiencing somehow tied to the mRNA vaccines? If you want to check out that interview in its glorious entirety, you can do so over on Epic TV. Just head on over to your computer or your smartphone and type in www.epictv.com/factsmatter, and you can find that interview at the very top. It'll be the top interview for today because we just published it earlier today. So head on over there and check it out because, quite frankly, there's a lot of great facts that are revealed in the course of that interview, and after you watch it, you can make up your own mind as to what you believe. Again, that's www.epictv.com/factsmatter. And then until next time, I'm your host, Roman from the Epic Times. Stay informed and stay free.